helped a patient with unrelenting fatigue from long COVID recover all his energy in 1 month, and his tongue spilled the tea. Let's talk about it. We'll call him Kyle. I put his tongue photos into our development prototype of Claros, and it came back with this report of his microbiome. It also predicted the afternoon fatigue spells and the mid-morning energy dips. Prevotella is an LPS producer, which is why it's thought to drive a lot of the inflammation people experience after infections like COVID. Let me know if you want me to do a video on that. And this study found that Prevotella was elevated in the oral microbiome of patients with chronic fatigue syndrome, which is usually post-viral. I'll be darned. In the form of medicine I practice, we call most presentations of long COVID a kind of dampness, as what you can see in the tongue. That thick coating is from excess biofilm, which is not only candida, but is often related to candida. Candida is a normal part of the human microbiome, but when it grows in excess, it can cause a lot of problems. It's sort of like these doozer guys from Fraggle Rock. It's a builder. The problem when you have a damp plague and excessive amounts of biofilm in combination is that the virus uses it like a pillow fort to hide in, and then it can linger for months or even years. The solution, though, is not to eat your boogers. That's just for Fraggles. It's to do the thing that Kyle should have done in the first place, which is rest. He had huge energy dips at 10:30 and 3 p.m. every day. He would power through these because he's in a high-pressure competitive career. Unfortunately, that resulted in him getting unrelenting bone pain. The reason he got sick in the first place was because the second he tested negative, he jumped on an airplane and went back to work. One of the largest traps I see patients and even their doctors fall into is believing that if objective tests don't show a problem, symptoms can be ignored. This plus biases is why women are told that fibromyalgia pain is all in their head, and it hurts men too. This is the walk it off or sleep when you're dead work ethic. Mature forms of medicine understand that symptoms are your body trying to alert you to the fact that you have a problem, and usually your body trying to help fix that problem. Just because your fever broke and you're testing negative doesn't mean you're ready to go back to work if after you get out of bed, make yourself a cup of tea, you're sweaty, dizzy, and you need to go lie down and take your second nap of the day. 2,000 years ago, this was documented in this book, which we still use as a text in Chinese medicine practice. The author explicitly warns that physical overwork, mental stress, lack of sleep, eating the wrong foods, or attempting death by snoo-snoo will cause the cold that you thought you were over to come back. So Kyle recovered very quickly when he did the right things. I'll tell you exactly what they are. The first was to engage in therapeutic amounts of rest. He had to set a consistent bedtime before 10 o'clock. He had to sleep as long as he could without setting an alarm to wake up in the morning. And I told him if he got tired during the day, he needed to lay down. Even if he didn't nap, he had to rest, and he did it. The second was to omit stimulants like coffee and then things like refined sugar, alcohol, greasy fried food. That's all bad if you have dampness. And the third was a pattern-appropriate herbal tea called Wind. This is where we start about 80-90% of our long COVID patients. It's part of the stage 1 protocol.